Hi, my name's Bella, and today we'll be talking about coercive paraphilias. The first paraphilia we will be talking about is frauderism. Frauderism, by definition, is the touching or rubbing against a non-consenting person, usually in the genital areas. As for origins, those who practice frauderism enjoy experiencing a private sexual experience in a public setting. Although it can occur at any age, the problem is most often seen in young, seemingly shy men between the ages 15 and 25. The Diagnostic and Statistical Manual of Mental Disorders called this sexual disorder by name fraudage, then frauderism, then frauderistic disorder. Frauderistic acts were interpreted as signs of a psychological disorder in 1887, and the word derives from the word fraudage, which take that part out. As for treatment, for any treatment to be successful, the person must want to change their patterns of behavior, and this initial step is difficult for most people to take. Individuals with this disorder generally do not pursue treatment on their own and only receive help after they are arrested for sexual assault and treatment is mandated by the courts. The next step would be psychotherapy, so a therapist can find them the best treatment, such as behavioral therapy. In behavioral therapy, the person must learn to control their impulses and manage sexual urges and direct thoughts to more appropriate ways. In addition, medications such as hormones and certain antidepressants may be used to help diminish sexual desire. Next, we'll be talking about necrophilia. By definition, necrophilia is the sexual intercourse or attraction towards corpse. In history, necrophilia was much more common than today, where now it is seen as a very rare and poorly understood phenomenon. According to Herodotus, the ancient Egyptians would take precautions against necrophilia by prohibiting the corpses of the wives of men from being delivered immediately to embalmers, for the fear that the embalmers would violate them. In addition, according to a legend, King Harold had sex with his wife for 7 years after he killed her. Next, we'll be looking at treatments. As for treatments, one of the best treatment methods may be behavioral therapy. This type of therapy applies behavioral therapy techniques in order to modify distorted thinking patterns that lead to justification for their urges. Another therapeutic technique that has some success is called orgasmic reconditioning. This is a technique in which people are trained to masturbate to a more appropriate stimulus. A third technique involves social skills training. This may include working on issues like developing intimacy, increasing conversational skills, and learning how to be more appropriately assertive. Next, we'll be talking about pedophilia, which is a sexual preference for children. As for origins, pedophilia is believed to have occurred in humans throughout history, but was not formally named, defined, or studied until the late 19th century. Krafft-Ebing mentioned pedophilia erotica in a report of psychosexual perversion. Here he wrote that he had only encountered it 4 times in his career and gave a brief description of each case, listing 3 common traits. 1. The individual is tainted by heredity. 2. The subject's primary attraction is to children rather than adults. And 3. The acts committed by the subjects are typically not intercourse, but rather involve inappropriate touching and manipulating the child into performing an act on the subject. As for treatments, while treatment may help pedophiles resist acting on attraction to children, many do not seek clinical help because of the risk of legal consequences due to mandatory reporting laws for licensed professionals, including therapists. For people who do have the disorder and seek help, research suggests that, again, behavioral therapy may be effective, as well as medications that may be used in conjunction with psychotherapy to treat pedophilic disorder, again, by lowering their sex drive. Thank you. Those are the different origins and treatments of these 3 different coercive paraphilias.